We are now in day 3 of the government being shut down and funding not being decided on between the Democrats and the Republicans. We've been bringing that to you since the moment that it happened overnight the other day. And I did an interview with Congressman Bobby Scott here in Hampton Roads about how we got here, what he wants to see come out of this, and quite frankly, how long they think this can take place. And so we're going to play that interview that we did with him. And then as soon as that is over, or as soon as they come to the stand, we are expected to hear from GOP members, I believe, at 11 o'clock to hear their side of the story, as we are now, again, in day 3 of this government shutdown. Here's my conversation with Congressman Bobby Scott.
How did we get here? I mean, nobody wants a shutdown. But here we are.
You can't say that, because the shutdown deadline was September 30th. The House Republicans called a recess starting September 19th, and we're still in that recess. We haven't been in session since September 19th. So when you say they don't want to shut down, they're not acting like it. There is no urgency. They haven't been in town. Democrats have been in town. We were here on the 29th and the 30th, knowing that the deadline is October 30th, it's September 30th. We were here. They weren't. They showed no concern about the fact that the government was shutting down. So you can't give them credit for not wanting a shutdown.
What would you say to them, the Republicans who have made it very clear that they believe Democrats are to blame for this, specifically targeting Senate Democrats? What is your response to that? I mean, we're seeing it everywhere. I mean, the official White House Instagram page and everything is blaming Democrats.
They're going to blame the Democrats for all of their failures. You can just assume that right off the bat. Fact is, all they have to do to keep the government open is come up not with a bipartisan bill, but a bill that can just pick up 7 Democratic senators. Now, if you try to pass a totally partisan bill without any Democratic input, can't even get 7 Democrats to vote for it, that's not the Democrats' fault. It's your fault. I mean, the fact is that you can easily pass legislation in the House on a straight party line, no Democratic votes. Okay, they did it. But it has to pass the Senate, and it has to pick up a couple of Democratic votes. Just a couple. Doesn't have to have half the Democrats, a third of the Democrats, just 7 or 8 Democrats. And they drafted legislation by design that was so partisan that they couldn't get any Democratic buy-in. Now, okay, whose fault is that? What kind of leadership is it? And what kind of leadership is it in the Senate when the negotiations to try to keep the government open consist of, we're going to bring up the bill that was defeated twice already. We're going to bring it up again and vote on it again. I think that's the plan for Friday. They're going to vote on a bill that's already been defeated at least 2, I think 3 times. We're going to vote on it again. What kind of negotiation is that?
And I think to this point, to your point of how many Democrats they need, or non-Republicans, I think they only have 2 Democrats who have voted for it so far, and they're obviously multiple short of what they would need to get that passed. But I want to follow up on that.
3 Democrats if you count the independent.
If you count the independents, yes.
Who caucuses with Democrats.
Right. If you count
that would be one of the 7 or 8 they need.
Exactly. And so following up on that, we've heard a lot of conversation from both sides on what it would take, what they want in this particular bill, right? And so I want to hear from you to kind of explain it and break it down to your constituents, what you want to see, what Democrats want to see in putting forth a spending bill to fund the government. Why take this particular fight? What is it that you want to get out of it?
The first thing we'd like to do is a discussion on healthcare. People have no idea how fragile our healthcare system is after what they did. We can fix it easily in this bill. We'd like to discuss it. We haven't any red lines. We haven't had you have to do exactly this or exactly that. They will not discuss healthcare. The fact is, a lot of people's healthcare costs will be going up 50 and 100%. A lot of people will lose their insurance because they'll decide they can't afford it anymore. And everybody else's insurance will go up accordingly because people who don't have insurance do get sick, do go to the hospital, run up bills. And when people with insurance go to the hospital, their bills are a little bit higher to cover the costs that weren't paid. And so everybody has an interest in this. If you have an employer covered policy, your employer, when you renegotiate salary, will say, well, the insurance went up so much, we can't do much on salary this time. So everybody has an interest in this. If the bills aren't being paid, rural hospitals will close. Three facilities in Virginia are already slated to close because of the healthcare crisis we're in. Let's discuss it. They will not discuss it. They just want to pass their legislation and without any Democratic input and expect Democrats to vote for it.
Can you speak to the new kind of push from Republicans that they're saying now? We've heard it from the president. We heard it from Speaker Mike Johnson. We've heard it from Vice President J.D. Vance. All of them now are saying that Democrats want to give health care to undocumented immigrants, illegal immigrants, through federal health care options, which is not legal currently. What are your responses to them saying that?
Well, they said it. They're lying. Illegal people who are illegally are not eligible for any of the programs, healthcare programs. And even if they were, I mean, you're talking about if you covered them, you'd be talking less than 1% of the cost. And so to make sure that that 1% doesn't get covered, you're going to deny health care to working men and women. And I don't think working men and women have fallen for it. One, they know it's not true. And two, they don't appreciate the health care evaporating right before them.
Republicans have said that they want to just pass a 7-week or so stopgap bill to be able to continue on with funding the government. From your stance and from the Democrat standpoint, why not sign on to do a 7-week stopgap measure to keep things going and then continue to revisit the conversation over the course of the next month and a half?
I think we've offered that, except what they say is a what they call clean CR, clean continuing resolution, is not clean. If they go back to the original bill at where we were and say we're going to continue spending at that rate, fine. We can all agree to that. But what they are saying is a little stopgap means where we were minus what we rescinded, minus the big ugly bill, minus whatever else we don't want to spend. The problem we have with the Republicans now, and the Supreme Court has validated their strategy, is that the president is not obligated to spend money that the law of the land requires. You pass a bill, passes the House, passes the Senate, signed by the president, law of the land. The president is supposed to faithfully execute the laws. He's supposed to spend the money according to the plan that has been passed by law. And what the president has said is, well, if I don't agree with it, I'm not spending it. Okay, try to negotiate a bill under those circumstances where we can agree, you get a little bit, I get a little bit, and then the president decides, well, he's going to spend your part, but not my part. Well, why am I going to vote for that? We need to make sure that if it's going to be a continuing resolution, that it continues, and that the money that has been withheld is actually spent. We've got projects where money was actually allocated. People were expecting the money. The president just decided not to spend it. A business in Hampton Roads, $40 million project. Aberdeen Gardens, $20 million flood program. He just decided not to spend it. That's illegal. Well, we need assurances that if we're going to agree to a spending level, that level will actually be spent. And we have a little problem with trust because they have come back after they've gotten the votes to pass the budget, and they need Democratic votes to get the budget. Then they come back and have a little rescission deal where they take the Democratic priorities out. And on that process, they don't need Democratic votes. They can do that straight party line. Now, have they agreed not to come back and take the Democratic priorities out of the budget? No. Well, what are we discussing? What are we voting for? We're voting for a blank check. I don't think so.
You know that your constituents here in Hampton Roads, a very large federal military workforce. What are your concerns? And what do you tell them as they're looking at a government shutdown again within this decade and not getting paid, and from what it looks like, not knowing when the two sides are going to be able to come to a deal? What concerns do you have, and what do you tell them?
Well, I have the same concerns I've had all year when Doge was going through firing people randomly without much thought, just firing people right and left. I have the same concerns. We did pass legislation the last time the Republicans shut down the government to require the salaries, back pay be restored. But people can't work like that. I understand. We understand that. But the president said that if we don't vote for this blank check, he's going to fire people. He did not say if we vote for the blank check, if we do vote for the blank check, he will not fire people. He's going to fire people anyway. So, I mean, what are we talking about? What are we agreeing to? And this, frankly, we believe this is the only opportunity we will have to actually discuss healthcare, discuss whether or not the budget is a budget, whether or not it has to be fulfilled. This is the only time we have to actually discuss that. And they have decided that they're going to play strict party politics and not discuss anything. When they say they're going to let's reopen government and then have a discussion, like I said, the House has been gone since September 19th. The House has not been in session since September 19th. We could have been discussing before the government shut down, the 2 days before the government shut down, Monday and Tuesday. We could have been negotiating. Nowhere to be found. If we kept it, if we opened it, where is there any assurance that they would actually negotiate anything? You just kick the can down the road 7 weeks and then right back where you started from. I mean, we've been there. This isn't the first time we've dealt with these people. We could have been negotiating already, and they have done nothing. I mean, why did they not want to negotiate Monday and Tuesday when the government was open? No, they let it get shut down. And now they're saying, well, if we reopen it, they'll negotiate. Well, it was open. They weren't negotiating then.
Follow up to that, why do you feel like now is the only time that you can talk about healthcare? I don't know if I added only, but you said that
Well,
now is the time that we can talk about it.
well, they have been operating on party line votes all year, and have been ignoring Democratic input. They stripped, the estimates vary from 10, 15, 17 million people of their health insurance. And one problem that happens when the costs go up, people decide that they can't afford healthcare anymore. Well, there's one thing that those people have in common. They're all healthy. If they're sick, they'll just come up with the money and pay the insurance. They can't afford to be without insurance. And so the average for everybody with insurance at that point, the costs go up and more people drop out. This could be a spiral where a lot of people drop out and the costs go out of control. Now, it doesn't happen with the Affordable Care Act because we've set the costs at something that is clearly affordable to people, and that's being challenged because the costs will go up significantly. A lot of people will see costs going up 50 and 100%. I mean, costs doubling. And they will have to decide whether or not they can still afford the insurance. That's the only time we can, they are unwilling to even discuss it. And we have found that this opportunity is an opportunity we can at least discuss what we can do with the healthcare crisis they have created. We could have the same discussion 7 weeks from now, but by then, people would have gotten their bills. They would have dropped out of the Affordable Care Act marketplaces. Costs will begin to skyrocket and really go out of control. They have this little fund to help rural hospitals, $50 billion. The organizations representing rural hospitals say that's a drop in the bucket to the damage that this bill will do to rural hospitals. And a lot of them will close in spite of that. And certainly 5 years from now, when that fund ends, there won't be any rural hospitals.
Congressman, how long can this go on? And do you foresee this being resolved quickly, or do you have any concern that this could drag on?
I think
Even as long as the last one a few years ago was 35 days.
I think to a large extent it depends on the public. If the public decides they don't care about their health care, then the support for the Democratic position will collapse. If people think their health care is important, then I think they will convey that to the Republicans and tell them they should discuss health care and the fact that their rates are going up with the Democrats to see what can be achieved.
And as a Democrat, do you think that your party is ready for the potential of there being a long haul? I mean, we've seen President Trump, just speaking on him, when he digs his heel, he'll dig his heel. Are Democrats prepared also to take that journey with them?
Well, that's the problem. The Republicans have decided my way or the highway. As I've said, Republican members of the House have been gone from Washington for the last 11 days. I mean, then the shutdown, before the shutdown, gone. So, I mean, they've shown no concern. And so they apparently are willing to, they've shown no urgency about the shutdown. And I think when people see and begin to understand the crisis, the healthcare crisis, and the effect it will have on them, whether they are part of the Affordable Care Act, whether they get Medicaid or not, their health care is in jeopardy. And when people begin to get more and more understanding about that, they'll convey whether or not they care. If people don't care about their health care, then Democratic support will collapse. I think people care about their health care, and there are too many people that will die when their health care gets cut off.